At the start of winter, many of us smile at the thought of Jack Frost nipping at our nose. But as the dark days of winter drag on, that cold nip can become painful and debilitating. But when should you see a doctor for potential frostbite? Essentia Health Emergency Medicine Dr. Chris Anderson says it's really a matter of severity. Most of us have probably had frost nip when skin gets very cold and white. But after being rewarmed, there's no permanent damage. But that's not the case for frostbite.
Over time, frostbite will often progress to fluid-filled blisters. You can get even blood-filled blisters. And over time, after 2 or 3 weeks, frost-bitten tissue will turn necrotic, black, and eventually slough off or fall off.
Dr. Anderson says in severe cases, fingers, toes, or limbs even need to be amputated, and they see several frostbite cases every year. Sometimes it's people caught unprepared, but more often it's something else.
The most common scenario is actually drug and alcohol use. Alcohol can be a big contributor. Their judgment gets clouded and they end up being exposed too long, and it can can also affect the sensation in your limbs, so you may not notice changes as quickly.
Dr. Anderson says the absolute best medicine for frostbite is prevention. Use common sense when temperatures plummet, as bare skin can be frostbitten in a matter of minutes, depending upon wind chills and exposure.
Plan ahead. Make sure you're wearing proper clothing and have a good plan of how you can get warm if you need to.
If you suspect frost nip or frostbite, Dr. Anderson says to soak cold skin in water between 100 and 104 degrees. Any hotter and you could burn yourself. If after a few minutes the skin still doesn't look or feel normal, or there's a change in sensation or an inability to move, you should go see the doctor. Frostbite is nothing to mess around with. With this Essentia Health Medical Insight, I'm Tracy Briggs.